Hello, and welcome to the IU College Insider Podcast, a collaboration between the College of Arts and Sciences at Indiana University Bloomington and Indiana Public Media. We'll be sharing the voices and experience of guests who shed light on what higher education is doing to improve our communities, our health, and our shared future. Today, we're focusing on one of the most urgent challenges facing young people, families, and schools right now: youth mental health and suicide prevention, and what research is revealing about how we can do more and better to support young people. I'm Rick Van Kooten, Executive Dean of the College of Arts and Sciences at Indiana University Bloomington. I'm joined today by three guests whose work is at the forefront of this issue. First, we have Anna Mueller, the Luther Dana Waterman Professor of Sociology in the college and Senior Research Program Leader at the Irsay Institute. She's also the author of Life Under Pressure: The Social Roots of Youth Suicide and What to Do About Them. Next, we have Tiffany Benjamin, CEO of the Humana Foundation, which has invested significantly in school-based youth suicide prevention, including a landmark grant right here at IU. She's also a proud alum of the college and IU. And finally, Natasha Chaku, Assistant Professor of Psychological and Brain Sciences at IU Bloomington, whose research uses cutting-edge methods to understand how and when students seek help and what sometimes gets in the way. Before we start, if you or someone you know is experiencing mental health or substance use crisis or is having thoughts of suicide, please call or text 988 to reach the National Suicide Crisis Lifeline and speak with a trained crisis specialist 24/7. Here at IU Bloomington, the crisis hotline is available to students 24/7 by calling 812-855-5711. Thank you for joining us, and let's turn it over to our guests.
Great. Let's get our conversation started. Anna, your book, Life Under Pressure, examines communities hard hit by what you call youth suicide clusters. What did you find about why certain environments put younger people at higher risk? And what role do you think schools play in the clusters and in the challenges we're seeing there?
Yeah, thanks, Tiffany. So one of the things that we found in the book is that the social environment that surrounds kids in their everyday lives is deeply important to both their vulnerability to actually experiencing psychological pain, as well as their willingness to get help when they do go through those difficult times, which we know for all of us are just a part of life, right? That's going to happen. And in the community that we were working in, which, as you said, had a series of recurring youth suicide clusters, which is basically when 3 or more youth die by suicide in a short period of time, all from the same community. And what we found was that in this particular community, there were several sort of what we call social roots of suicide that were embedded in the social environment, increasing youth's vulnerability to suicide. The first one was the least surprising, and that was that, unfortunately, mental illness and mental health help seeking was very stigmatized in the community. And so that, of course, made it way more difficult to say, I need help when those difficult times came. The second was more unique to the community, and that was that the community was home to really clear, broadly shared, and very specific and narrow beliefs about what made a good kid good. And I am definitely using quotes around the word good, right? Because there's so many ways to be good. But and basically what that meant is one of the things we know about human psychology is it's very hard to disappoint people. It's very hard to not meet expectations, particularly when it's people that we really admire and care about, like our parents, our teachers, or even the popular kids in school. So what we saw was that those narrow expectations really intensified pressure on kids in the community to live up to that particular way of being. And it meant that kids actually had intense fear of failure and experienced a lot of shame around things that, frankly, I did all the time as a teenager, like getting a B or dropping out of an honors high school course. And so that was that just essentially intensified the psychological pain that they were experiencing over things that I would consider somewhat normal parts of adolescence. We can't all get A's all the time, right? And then the third thing we found in the social environment was perhaps the most surprising, and that was that this community was so highly socially connected. Everyone knew everyone cared about everyone, and there was actually a beautiful amount of social support flowing through these neighborhood social ties. But the problem many of us who've lived in a small town can begin to anticipate is that that also meant that information flowed freely through the gossip networks in the community. And what that meant was that deeply private, sometimes painful information could easily slip into the public domain. And since mental illness or having mental health struggles was so stigmatized and was seen as like antithetical to being that good kid that kids were supposed to be, that really intensified the threat that came alongside help seeking and just made it way harder to seek help when needed. And we actually saw those factors tied to kids' risk of suicide among the youth who'd actually died or attempted suicide in the community. So to your second question, schools have a wonderful opportunity to be a great disruptor in these kinds of problematic sort of, cultural environments, but they can also be places where those cultural expectations and messages get intensified. Schools are also a wonderful place to, insert programming to destigmatize mental health. Actually, in the state of Indiana, we've got some great programs that our schools use, like Bring Change to Mind or Sources of Strength, and there's others, right? So we have tools that we can use to address these in our school environments. School staff also have this wonderful opportunity to help us identify kids who are struggling and connect them to the care that they need without them having to ask for it, right? Which is so crucial sometimes. So I think those are kind of some of the main things that schools can do to help prevent suicide and promote happy, healthy child development.
Yeah, as a mom of a 16-year-old and a 14-year-old, and I also got a 10-year-old, I think what you said there is really real. And I think sometimes as adults, we take for granted the stressors that sit in kids' lives these days and how elevated they can be because of how isolating their existence is in ways that are a little bit different than the ways that we were isolated in our youth.
That's so true. And youth are sort of going through a very specific developmental stage, right, where these peer relationships can be more important than, we as adults might say than they should be, but it's just a part of child development, right? To turn to peers, to begin to pursue independence and figure out who you are. So yeah, we have to be attentive to how society changes and how that changes what our kids are experiencing and our own memories of what it was like versus what it's like to be an adult.
Natasha, you bring a developmental psychology lens to this work. You focus on what's actually happening inside adolescents cognitively and emotionally. What does that perspective add to how we think about prevention? Whether it's a purely social or systems approach, or what we might be missing in this broader discussion?
That's a great question. Anna really set me up perfectly when she started talking about the heightened importance of peers in this developmental stage. So when I think about development, or I think when most people think about development, we think of it as this very linear, straightforward process. If you think about infants and young children, we can track their milestones in terms of physical development. Eventually, an infant lifts their head and they roll over and they sit up and then they stand and then they walk. And all of those milestones are met with so much excitement by parents and educators and caregivers. But then as their social world expands, they move from just being with their nuclear family to then starting to venture out into the world and then into schools and then into even larger school ecosystems and then eventually into the world. Development doesn't seem to be as straightforward or as linear. And we find that kids take different paths and end up in the same place. And sometimes they start in the same place and then take different paths and end up in different places. And I think understanding the individual differences between young children and how they emerge, intensify, and persist across adolescence is a really key piece of my work and also the work that Anna and I do together. So right at the start of adolescence, kids start to go through puberty, this dramatic biological, psychological, and cognitive transition that really has some interesting physical aspects of it, but it also spurs on this second accelerated period of cognitive development. And I think that period of cognitive development is really interesting because adolescence focus turns both inwards and outwards. So Whereas as a young child, they might have all sorts of opinions about themselves, like, I like the color green. I love trucks. Like, Sally is my friend. When they become an adolescent, as these cognitive abilities lead them to be able to think in more abstract and unconventional ways, they start to think about more evaluative things like, well, what am I like? How am I perceived? And what do I want to do in the future? And I think those things are really positive for young people because adolescents tend to find their passions, their career trajectories. They tend to find their best friends, their future partners. But it can also turn negative when they don't perceive themselves as fitting in or as having friends or as liking themselves, really. And so I think this duality is really interesting about adolescence as a period of really positive growth and development. And sometimes it can sort of turn on them in ways that we can help sort of address and prevent if we consider their social environment in conjunction with like what's going on inside their bodies and brains.
Yeah. And Natasha, I just really appreciate you highlighting the lack of sort of a one size fits all and that different kids are on a different journey in this time. I think oftentimes when we talk about mental health or emotional health, we sort of look at everybody through the same lens, but that's not the reality of everybody's journey, right? And so you can put structures in place and also understand that different kids are going to need different things based on where they're at in that cognitive process you were talking about.
Yeah, absolutely. I think the more work we do in this vein, the more and more so, and I mean, parents have always known this, right? Like no child is just exactly like a different child, but every child is unique. Educators, I think, grow to learn this very rapidly when they enter the classroom. There's no average student or typical student. And I think mental health care workers are, of course, aware, like there's no average patient. And so the more I think actually our research can come into line with the sort of personalized or individualized work, the better and more precise like our interventions and prevention strategies will eventually become.
So now we're going to turn it back to you, Tiffany. I know the Humana Foundation is really passionate about this topic of mental health and suicide prevention. And so I wonder if you could share from your perspective some of the things that you really value in this work and some of the work that the Humana Foundation has been doing and kind of your approach to this topic.
Yeah, first, I just want to say thanks to Anna. We've really been honored to uplift the work you're doing around youth and frankly, how thoughtful the work is about intervening and making a difference and not sort of just the reporting out. So for us as the Humana Foundation, we are very focused on health equity generally, and we have two focus areas, which are mental health and then food insecurity and nutrition. We came to this work around youth suicide prevention actually in sort of a circuitous way. We initially had a lot of focus on seniors and older adults, and then we transitioned to doing some work around veterans, but we just started to see the data led us to the fact that you can't start talking about mental health when someone turns 55. And then, frankly, I think COVID really laid bare for all of us how significant mental health is and how important emotional health is to people and the distinction between mental health and mental illness, right? So for us, we just followed the statistics. And if you look at the statistics, suicide is the second leading cause of death among those aged 10 to 14. And for us, we also do work with veterans. And what we saw is veterans had a suicide rate that was 60% higher than the civilian population. And so the data told us we had to go here. And so we started to really think about the ways in which we could support work across the country and really leading experts who were doing work at academic research institutions, but then people doing on the ground work as well. And so we fund things in places like Florida, Texas, and Louisiana. We've got a great project in Texas with Meadows Mental Health Policy Institute. We're doing some work in Florida as well. And then we really tried to think about like, what are people doing on the ground? But then how are we proving out solutions that can be scalable And that's how we came to the work with you, Anna, and thinking about how we can really get people across the country to understand there are some really simple and sometimes difficult solutions that can be scaled or implemented in your geography. We just talked about schools, the ways in which schools can operate. As Natasha said, it's positive places, but also places for opportunity to look at challenges. And so we've just been trying to think about, like, how do we get solutions on the ground to people? And then how do we share that so that more and more people can learn?
I love that. I mean, yeah, I think we share that approach entirely. And part of my reason for caring about doing work in that way is that suicide prevention, it's going to take us all. But also a lot of the people who are on the front lines of suicide prevention are people who have a lot on their plates. And so we have to find ways that we can identify barriers that they are directly experiencing and nudge them out of the way so that we make it easier to turn towards supporting youth mental health and connecting that with them when they're in those moments of not just crisis, but also just pain or suffering or distress, right? That's another thing that I've really tried to do in my work is to sort of reframe for educators how we think about suicide prevention. It doesn't just have to be that moment of crisis. And I think this is where the perspective of the Humana Foundation and my work really strongly overlaps is if we build those strong emotional connections, if we facilitate trust between students and school staff members who are the adults in the primary extrafamilial social context of their daily lives, they spend so many hours in their school buildings. If we facilitate that trust, that connection, when those tough times come, it's going to be so much easier for kids to reach out, right? Particularly if we're attentive, as Natasha said, to some of the differences. And this is, for me, is why it's so critical to work with Natasha and a developmental psychologist who can really flesh out the complexities for kids and those connections to adults in their school buildings and their unique sort of barriers and facilitators for help seeking. In my recent work, I've turned towards school staff and focusing on them and how can I help them do this work. But then it doesn't matter if it's not meeting the kids where they are, right?
Yeah, exactly. And I think a lot about what Natasha said. As we understand death by suicide, and I certainly don't claim to be an expert, but we understand there's a little bit of impulsivity there. And so the ability to get the people around kids to really understand how to identify things that are signaling something significant, to understand those developmental stages, I think just becomes more and more important. And Anna, you kind of touched on some of the work you're doing, and I want to double down on that. Your Connect to Care school study is built around emotional connectedness between school staff and students, like you talked about. What does that actually mean? How is it working in practice? And talk to me, and I think Natasha, it'd be great if you chime in this too, why are relationships so important as part of your study, but also in part of this work more generally?
Oh, that's a great question. I'm going to start with that. Why are relationships so critical? And also, why are relationships with school staff so critical? So one of the things that Natasha, I'm sure you would double down on this too, is that our teenagers are more likely to turn to each other rather than to adults when they are struggling, particularly with things that are difficult to talk about, like suicide or mental health. But it's also true that adults are often more prepared and capable to connect those kids to the actual care that will be supportive and help them get through that difficult time. So we have to kind of counteract their natural tendencies to turn to each other by facilitating those emotional connections with school staff members. Of course, you can also facilitate emotional connections within your families, within your faith communities, within your neighborhoods. I don't want this to, and our healthcare institutions, right? Your pediatrician or family medicine doctor, but because schools are so central and kids spend so much time in them, our school staff members are really our best eyes and ears for identifying kids who are struggling and being that trusted adult for them. We also do know that trusted adults, when teenagers have a trusted adult, they are so much less vulnerable to suicide. And when that trusted adult is in school with them, and in fact, there's some wonderful work that Peter Wyman and his colleagues have done that really shows that actually also when a lot of kids trust the same school staff member, that trust kind of intensifies and can be really protective against suicide. So this is one of the best strategies we have for building a really robust, effective mental health safety net to surround our kids with in their everyday lives. So that's why working with school staff to kind of figure out how we can facilitate it, that connectedness is so important to me. The study is basically trying to understand barriers and facilitators of it. It's in that sense, it's real basic. We spent a lot of years listening and learning from school staff in school buildings, and then we designed a survey that captures a lot of the common experiences that they have. And now with the support of Humana, we've now taken that to a much broader set of schools and a much broader set of rural and urban communities that are facing different local challenges, so that we can sort of build out that knowledge even further. And we have begun to identify some pretty movable pieces that if we address, we can really see some change in our school buildings, making school staff feel safer and more prepared to take on these questions that we need them to do as a society just to help us help our teens.
I'll just echo Anna here that adolescence is a time where young people are primed to go seek out and form new connections, and they often do so and are most interested in forming connections with people their own age, so their peers, their friends, and that is an important context for understanding their behavior. And at the same time, something I often tell parents and teachers is that they're interacting with and forming friendships and connections with people who are their age and have the same set of generally limited experiences. And so they're not as helpful for helping youth navigate stressful experiences. They don't have that same wealth of life history that teachers and parents do. And so caregivers for young people are really like the seatbelts for their brains. That's what I like to say.
I love that.
Yeah, their brains are up and they're moving and they're thinking in all sorts of amazing and creative ways, but they sometimes just need someone else in their life to put a little pause or help them sort of press the brakes a little bit. And parents do that to such a fabulous extent for their young children. And I think despite, some of the media depictions, parents and children generally report fairly close and positive relationships, into adolescence, past adolescence, and into adulthood. But what has been so interesting and innovative, and I think, frankly, groundbreaking about Anna's work in particular, is that everyone goes to school. It is a soft touch and a soft point where we can hit every single kid for the most part at multiple points of their development across multiple settings. And teachers and school staff are wonderful and caring people. So we have a built-in bolus of individuals who are already there to help kids live happy, successful, healthy lives. And so I really see Anna's work and my contribution to that work is identifying, what are the structures and systems in place that prevent you from doing your best work and helping youth? And then also, conversely, are there things that we could do to make your jobs easier? And I think we kind of attack that from both ends, I would say, right? We have a ton of staff data now, which has been, for me especially, really illuminating about how barriers enact themselves and how things can facilitate staff being really empowered and positive forces in their schools. And we've recently also started collecting some data with young people themselves, and that's been really illustrative on, how do they seek help? Who do they seek help from, and when and why? And I think those are all really interesting sort of future questions that we'll be able to address in this research. So we'll be able to bring out the staff perspective and the student perspective as well.
So first of all, just as a native Hoosier and a graduate of the IU College of Arts and Sciences, I just am so thrilled that we have this innovative, evidence-based, solution-oriented research happening at the school with two exceptional researchers. And Natasha, you started to talk about the work in the Connect to Care study. And I know that you've been developing daily assessments that capture students' help-seeking behaviors in real time. What gap does that fill? And what do you hope that it tells us that we don't really know right now?
Yeah, it's a great question. There's quite a bit of work coming up and related to help seeking out there already in the literature, and I think there's a lot of great work that suggests that help seeking is instrumental to suicide prevention, that empowering young people to seek help, to know what signs are important, to identify them in their friends, to identify them in themselves, to give them the resources in general. I think there's a ton of research suggesting that all of that is true. And at the same time, there's also a lot of research suggesting that young people don't often use these help-seeking strategies. So a little bit of our work is just descriptive. We're trying to see on a daily basis from day to day in schools, who are people turning to? Are they turning to teachers? Are they turning to other school staff members? Are they turning to their friends or peers or partners? And we developed a lot of these help-seeking measures actually in consultation with the Youth Advisory Board, with wealth of undergraduates who have educated me on all of the new ways people are using technology in their lives. And so I actually think we have a very comprehensive list of all of the sources that young people could turn to, everyone from their significant other to a chatbot or some sort of like large language model AI system, which seems increasingly that youth might be putting in some personal and private questions into that space. But our hope is to get a better understanding here of, like, on a day where you experience stress, a mental health concern, or an academic problem, who are you turning to? Are they helpful to you? And like, how do you feel the next day? And when we can get some of that fine-grained information, we might be able to, like, for example, develop like brief interventions for folks far, far down the line. We're not at that point yet, but there could be sort of an outlet where we start thinking about, like, what are these micro interventions or quick touches we could make for people to encourage them to seek help at the right time, like in the right way.
Yeah, I love that. And I just love the concept of sort of making it bite-sized for people. Because when we start to talk about these topics, it can feel overwhelming and like the solutions have to be massive. But I think, Natasha, both you and Anna talked about the relationship components of this and how important that is. I certainly don't understand all of the forms of technology my children use or any children near me. But humans will continue to be an extremely important part of this mental health work. And that relationship component really matters, which is why the work you're doing around understanding how we improve relationships, remove barriers to that relationships is deeply important if we really are going to get at what is, frankly, a crisis.
So, Tiffany, we just kind of shared with you some of the solutions that we're thinking about and that are coming out of our work with the Connect to Care in Schools study. I wonder, based on Humana's current and prior programs and what you've learned as an organization, how is the foundation thinking about the path from a funded study like this one to real-world impact in schools and communities?
Yeah, I really appreciate the question. I think to us, one of the things that's really important is scale, right? So we seek out innovative, scalable solutions to challenges. And the reality is that there may be programs that are operating really effectively in certain places in the country. And that is wonderful. But if we don't all know about it and we don't have data that tells us what's effective, there's not a lot you can do with it, right? And so to us, investing in research like this really allows for a proof point of solutions that work. And our hope is that if we invest in research and show people, hey, this type of activation works, remove this barrier and it works, and here's data to show you that, we will see adoption all across the country. And so our real goal with our research strategy is to find people who are really thinking about how do we build these things that work anywhere, but understand that not everything works for everybody, right? That's really hard. But there are always trends you can pull out. But if we don't share those trends and we don't have data behind them, it's really hard to adopt them. That's why we're thrilled to do this work with the two of you, is because it's a way of showing people, here are some simple solutions, and here are the actors who can really help you drive change and reduce youth suicide rates.
I really appreciate that. I think one of the things that people don't always realize is that data is a huge limiting factor when it comes to suicide prevention and knowing how to intervene in ways that actually bring change. We have a lot of great data, but we also have so many profound limitations in how we collect data. And so, thank you for the support. I think it's going to lead to great things, but I also just want to reaffirm that I get asked so many questions when I'm out speaking to communities, and I have to say, I'm really sorry, we don't know the answer to that. We should, but we don't have the data. And that's very frustrating, particularly when we are facing rising rates of youth suicide, right? This is an issue that researchers can take on, of course, but it's also helpful as state governments and the federal government also sorts of begins to shift the way we collect data about youth suicide. And, one of the most fundamental things I think we need to start doing as a country is actually collecting information about what school a student attended when they die by suicide. We don't have to make that information public, but we can make it available for, researchers to use in highly secured private spaces, which we have on campus, and so that we can begin to understand what kind of schools do a great job, what kind of resources, how do we efficiently invest in the right resources in the right context? Not every school is going to need the same things. So we have ways to go, but I think partnerships like this give me a lot of hope for the future.
I think so. And I think that the power of us continuing to talk about this work and tell people there are solutions that are working. It's part of the power. We started this off talking a lot about stigma. And I think the more we invest in solutions like the ones that the two of you are working on, the more we can do on the stigma side as well. And so I'm really excited about removing these barriers, but then also the more data we have, the more we can normalize these conversations.
Absolutely.
So I want to ask you both. Teachers and counselors and school staff are on the front lines every single day, but they're often not provided with mental health training. What's the most practical, useful thing your research can offer them right now?
I think one thing I want to just a brief clarification. Teachers are often not provided sufficient mental health training. They do often have some knowledge of mental health in adolescents, but when it comes to suicide prevention specifically, there's actually no guarantee that even our school-based mental health teams have actual training in suicide prevention. That can also actually be true of our psychologists, our therapists, and community settings as well. So it is really important that school districts provide their school staff with role-appropriate suicide prevention. We often call it gatekeeper training because the emphasis is often on identifying and then talking with kids at a basic level to assess what degree of risk they're experiencing, and then referring them for appropriate additional follow-up care, which is often outside of the school building, right? There's a huge role for mental health care and crisis care outside of school buildings. One of the things that we're doing with our study is we're actually collecting data on what are the barriers to accessing those trainings in suicide prevention in our school buildings. And then how can we help states actually begin to close those gaps and support school districts? Because a lot of our states, like the state of Indiana, as well as the state of Colorado, the two places where we've been working with the Connect to Care in Schools study, they both have resources that schools can draw on. I'm not saying it's always easy or it's always perfect, but one of the things I want our study to do is to help close the gap between what is available for free or for a very low cost, and just helping schools understand how to access it and helping states understand what they need to do to meet schools where they are.
I think that's a really good point. I'll add on to that. Our teachers and our school staff and our administration are so busy, and they are already doing a lot of work for students, which is why I'm so glad that Anna brought up that one of the goals of the study, but also like practically, is that there are things that can happen on a larger structural level, for example, at the state level, that can help close the gap to reduce barriers and increase facilitation of staff and school efforts. And then I would offer on an individual or person-to-person or teacher level, teachers are really viewed as a trusted adults, as like a safe third person or a mentor in young people's lives. And we know that the more trusted adults young people have, the less vulnerable they are. So they should feel empowered to notice everyday patterns, to ask not just at moments of crisis, but just every day or from day to day, if they notice something off, like, how are you doing? Mm-hmm. Can you tell me about what's going on in your life? These are just like simple, quick check-ins that do make youth feel safer and will prevent sort of larger crises. And these are simple things that can be integrated, I think, just into a typical school day that should not feel burdensome, and teachers should feel empowered to do.
I want us to redefine how we think about suicide prevention. Checking in with a student, if you just notice their heads down on their desk and just saying, hey, are you okay? That is suicide prevention.
Yes.
That is the most critical first step. It is an invitation to share. It is an invitation to say, actually, I'm having a really rough day. And then what I want the school to train teachers to do is to say, well, you know what? We have someone who can actually go a little further with you. Can I walk you down to the counselor's office? So we are keeping our asks very role appropriate, very, very actionable. And, you know, one of the critiques that I encounter often when I'm out speaking in community settings is that schools are doing too much. This is going to stress out school staff. This isn't wanted. Find someone else. Poor schools. And I have so much empathy for our teachers and our educators, so much empathy, especially after shadowing them for 4 years and watching how hard they work. But actually, our school staff are really hungry for this. And it's in part because they're encountering students who are experiencing trauma, serious psychological pain, suicidal thoughts. They are there in their classrooms and they want to know what to do, in part because they care. We have incredible endorsement of we should be doing this work in our surveys across Indiana and Colorado. The message is clear. We also collected representative data across the state of Indiana from adult Hoosiers. And our families and our communities, they want schools to be doing this work. It was over 90% of people say schools have to play this role for us. So we have the mandate. We just need to go there and figure out the strategies to meet, to rise to this occasion.
Well, and I think it's really exciting that the research provides opportunity for individuals who care, but then frankly, it provides a broader perspective for people who have to implement policies and make broader decisions. And the goal isn't to make it overwhelming. It's actually just to lean into what people already care about and give people guidance on things they're already doing to make that more effective. And I think that's, for me, really exciting to say tweaks here and there can really help and not overwhelm a system that's already a little bit overwhelmed, right?
Right.
Absolutely.
Yeah. And we also are collecting some data on staff's well-being themselves so that we can figure out which of these strategies will actually help protect their own well-being and help protect them when they are doing stressful work. I mean, it is hard when one of our students is thinking about suicide. I think it's important for us to acknowledge that, to hold space for that, and think about, okay, how do we help the caregivers, right? And not just the child. I want to help the child, obviously, but we also need to find ways to support school staff and protect their mental health, protect their own burnout or vulnerability to secondary trauma. So that's also things that we're looking at with our policy work and our data collection that I think is really crucial.
Well, I want to thank Anna and Natasha for joining me today for this really important conversation. As a graduate of the College of Arts and Sciences at IU, a native Hoosier, and a person who cares deeply about this work, not just because my mom was a social worker and because I have teenagers, but because I am living in this world and I know how important our youth is to our future. I'm just deeply honored to support the work that you're doing to elevate helping kids and helping the people around kids and talking about mental health with young people. So I want to thank you both for this work. I want to say I'm really excited about the impact it will have in communities in Colorado and Indiana, but frankly, across the country. And I really look forward to us all continuing the conversation around youth mental health and suicide prevention.
Yeah, thank you so much, Tiffany, for having us. This has been fantastic.
Yeah, thank you so much. It's been really great to have this conversation and to continue to have these conversations, especially as we work to support youth and their families.
Thank you to everyone watching and listening, and thanks so much to Anna, Tiffany, and Natasha. This is exactly the kind of conversation that can make a real difference. And again, if you or someone you know is experiencing a mental health or substance use crisis or is having thoughts of suicide, please call or text 988 to reach the Suicide and Crisis Lifeline and speak with a trained crisis specialist 24/7. Here at IU Bloomington, the crisis hotline is available to students 24/7 by calling 812-855-5711. For additional resources for educators as well as members of the public, please visit connecttocarestudy.net. That's all one word with the number 2. Please subscribe to the IU College Insider, a collaboration between the College of Arts and Sciences at Indiana University Bloomington and Indiana Public Media. See you next time.